So I have a question for you.
Yeah.
Now, and so this is flip side to what you just asked. What because people's diagnosis with diabetes starts at doctor's office. So what can, or maybe this is something, our community maybe can work with your community to figure out a way to help get rid of that stigma. So instead of saying, not saying that you say this, but instead of saying, okay, you have diabetes, this is how you got it, and this is, what you need to do to change. I think maybe it probably starts in that first visit. How can we break that stigma? How can we break that emotional, where a patient goes into denial because they're ashamed because they have diabetes, to get them to feel like they're not alone and they can manage this condition, because as we all know, peer support helps. But if someone is living with diabetes type 2 or type 1 and no one really knows if they have it, that's not healthy and that's not safe to a certain extent. So maybe there's needs to be a shift in the conversation, so we can help educate the public as much as possible. And I know we do that a lot online. A lot of people try to shut negative information down when it gets shared, but at the same time is what can we do behind closed doors, whether us as patients stop the doctor's office from saying, hey, wait a minute, I didn't do this, or, of course I need to make some changes, but help me deal with the emotional side off top versus going into that denial stage or that stage where they feel ashamed because they have the condition.
Yeah, that's a great question, and I think it comes down to having that really good relationship with your physician or provider or whoever that is, because hearing that from somebody like an ER physician who you see once, that's going to be a very different experience than when you hear that or you have that conversation with your primary care provider who you've seen for a while. And what I do is, I mean, and I deal with this every day. Maybe people, they're not only concerned about diabetes, but they're concerned if their blood sugar is 1 point above normal, and that comes with a lot of emotion. To try to reverse the stigma or to try to not have it is really trying to explore that, with your patient or with your doctor, because sometimes the provider or the physician has some, incorrect or bad preconceived notions about diabetes that you have to work through. From my end, I put the mirror up to the person and say, what concerns you about, diabetes, and there's always a story there. It's usually a family member who had a bad outcome or weren't taking care of themselves, or had some kind of medical illness that caused them to get diabetes. And they're scared of that because they saw another person, a friend or a family member, go through that and they had a bad experience. They had a lot of pain, or, they had some vision loss, or they had to be put on dialysis at some point. And it's just getting back to what we were talking about before, as far as the emotion part, is trying to explore those emotions and trying to see what they bring to the table as far as what is their story, why are they anxious about it. It takes a lot of time, in this healthcare system that we have now. I mean, it's hard to get that time to explore some of these things. But a good endocrinologist, a good primary care doctor, hopefully would recognize that and to try to spend the time with the person to try to explore that a little bit. It's not going to happen in one visit. It's not going to happen in 5 visits. It's going to be over a series of visits to really, really, really try to get to the bottom of things. Because, sometimes it takes me a while just to get, my patients to think about even, treating their blood sugar, and it's not because their blood sugar is, 200 or 300. It's just, their blood sugar is, 110 or 120. And it's just that stigma. You're right, Cherise. It's that stigma of having that label, taking the medicines, everything that means, diabetes. And I don't have any magic wand for that. It's just trying to explore with them, what their hesitation is, and doing that a little bit at a time.
Definitely. I like what you said. It's not going to be over, one visit. It may not be over 5. It could take a very long time. The fact that you acknowledge that is kind of cool.